Hello everyone.
Yes, children, thank you for the cooperation to you and the parents. Because we are doing it offline as well as online, we need to take care of few things. Because we have 7th standard student mothers who are attending from home. The reason being, last year also it went online. Yes, we actually do it in 6th standard. So we have given them that because they attended online, now again, if they have a revision of everything, the different speaker. So we have to manage both the things. That's the reason it took some time. Thank you so much for cooperating. Over to you, ma'am, please.
National Integrated Medical Association. National Integrated Medical Association creates various types of awareness programs. This month, they are carrying regarding menstrual health and hygiene awareness. 28th May is the Menstrual Hygiene Day. The theme of this year's World Menstrual Hygiene Day is Action and Investment in Menstrual Hygiene and Health. Now, why is this necessary? As on global level, 52% of female population is of reproductive age. In most part of the world, it remains a taboo and it is rarely talked about. So today we are here to discuss about a topic which really needs a keen observation and upliftment, many social issues, and even psychological behavioral changes which are taken place even during this COVID phase also. Many girls skips or leave school and education once they start with menarche. Lack of menstrual hygiene and its management to parents and school teachers. Lack of knowledge about sanitary practices, disposal of napkins, poor supply of napkins, tampons, etc. The main motive as per Ayurveda also is Supraja, that is healthy population ahead, healthy life ahead. When a girl is in the puberty, when menarche arrives, if it is on a proper healthy manner, and if she knows from her mother and a doctor, then we can say she can have healthy conception also ahead. So that is the main motive of today's lecture. A woman is considered, or we can name it in different languages as Stri, Aurat, Nari, Mahila. As per Sanskrit, Stri means Sraunat Stri. So one who menstrualizes is a female. Okay. So all present in the auditorium today, be proud you are a woman. There are various phases of woman's life. Child, adolescent, teenager, then pregnancy phase, adulthood, and then old age. Today, we will be particularly focusing. Today, we'll be focusing on the puberty group, the problems which are faced in puberty, or we can say different phases of puberty. First is menarche, means when your menses started. I'll explain in further slides details about puberty stages, what are the signs of puberty also. Menarche, then acne or pimples on face, anemia, that is hemoglobin levels go down, obesity, you can become fat, or any kind of deficiency, vitamin B6, vitamin D3, magnesium deficiency, then lack of proper hygiene, social and emotional issues. In today's session, we'll be focusing on menarche age group that will be starting from the age of, if we consider early menarche, it will be from 8 to 9 years of age till late menarche, that is 16 years of age. We are also focusing on the mothers of these age group and also teachers from school of this age group. Now, what is puberty? The period during which adolescents reach that maturity where she becomes capable for conception. Now, what are the signs of puberty? Some may have already started experiencing right now. So now, henceforth, have a keen observation on yourselves, and mothers will also look for the same. First is mood swings. Generally, many girls at this age group show tantrums. And then the things, they may be yelling out at somebody, talking in impolite manner, shouting, or showing angry faces, or behavioral changes also are experienced. So look at these changes which are experienced. I'll say again that these changes have to be accepted in a positive way. If you as mother become panic in this situation, that will affect your girl child's emotionally in that manner. And it may aggravate these kind of symptoms and she may need medical help. So accept these puberty changes in a very positive manner. Next is breast development. In this age group, breast development begins, and girls in this age are in front of mirrors for longer duration of time. So this is again expected and this is normal, and they may even observe the breast development also. So if it is a very early age, then I had a patient of 6 years coming to me. She was not completed 6 years also, a girl child. She had started developing her breast. So I'm saying this is early hormonal changes which are occurring in that girl child. So have a keen observation on your daughter's private parts also henceforth. Okay, if there are any kind of early hormonal changes which you're experiencing, and if you feel that it is early to that age, then you should seek medical help. Further is they grow taller in height. Sudden height differentiation you may feel from the age group of 10 to 11 years till 13 to 14 years. Then they may experience pimples or acne on their cheek region. Some also experience on breast, chest, and even back regions, and skin becomes oily. Then they may have a particular body odor also. If you're finding it too odd or very offensive kind of odor, and if you feel there are other puberty changes which are early or maybe late, then again medical help should be sought. Then this is the phase or the signs of puberty, that is menses or periods, it is mentioned. On that we will have a discussion ahead through the slides also and in details. Then body hair. On around the breast, that is the areola region, on your pubic region, that is the vaginal part, and in your armpits, you will be already might have started experiencing these changes. Then even your body shape changes you may also experience, like that your hips become broader, thighs and tummy portion also become little bulky henceforth. So these are the puberty signs which you will experience henceforth. Now, as I said, for Supraja, that is healthy population, and for healthy development or healthy menstrual phase of yours henceforth, some might have already started with menses or some might start. So that's why we'll be focusing on menstrual phase. Now, when you first experience the menses, you may experience some kind of fear. Okay. And I'll rather tell you, if it is well informed to you that you will get your menses, how it will be. So it's a duty of every mother to educate her daughter how menstrual phase will come, what she will experience. So then the problems which I have mentioned over here, fear, shame, embarrassment, will be nullified and would not be experienced by them, and it will be openly discussed with you. If you don't share it openly with your daughter child, then she will also not share it openly, and it will again take some other medias taking out information, and the information may be wrong or not may be medically true. And sharing with friends with their experiences which are not to the mark, or maybe embarrassing or creating more questions in their mind. So every girl should know about the female reproductive system. This is the uterus with the uterine cavity having inner that is the endometrium and the myometrium, the fallopian tubes, cervix and vagina. So that the menstrual cycle is mainly related to the endometrial this. We have a fixed cycle, that is the menstrual cycle, in which blood is shed off from our cervix, and during that we have to wear sanitary napkins. So we have a 28 days, medically we have a 28 days cycle. Okay. For every girl or a woman, this cycle may vary from 26 days to 34 days is medically. And if it is from menarche, for some 45 days may also be normal. If it is from the start itself, the cycle is same. Okay, so every 28 days, you will be having the menstrual cycle. So as I was mentioning that some may experience at early age. This menstrual cycle may be experienced at an early age, that is maybe 8 years. That is early menarche. Normal is between 8 to 13 years. And in India, it is considered 11 to 12 years as normal. Now, in the first day of the menstrual cycle, blood and tissues that have built in the endometrium, as we looked for the female reproductive system, the internal lining is the endometrium. Then it flows out of the vagina. due to the hormonal changes which are occurring in our body. Then this flow remains for 3 to 6 days. Again, it may vary. For some girls, it may be 1 to 2 also, and it may extend beyond 6, that is 7 to 8 also. But normal is 3 to 6 days. And you will be experiencing this cycle every 28 to 34 days. So now what henceforth we have to do once they are in the menarche phase, or once they are arriving in the menarche phase, we have to educate these girls about sanitary napkins. I'll be sharing the slides in further also. Then the application and disposal, self-hygiene, daily bath, intimate wash with lukewarm water and turmeric water. So I'll be focusing first on these self-hygiene, daily bath and intimate wash. Self-hygiene will also improve the self-awareness of the body. So during bath, every girl should observe herself and also take care of each and every private part also while bathing. Whether it is clean, dry, or whether you're experiencing any other kind of discharges over there, or any kind of pimples coming on maybe vaginal area, or breast development, or any kind of nodes on your breast. So keep a keen observation. Even generally, while bathing, even the vaginal part should also be washed properly with lukewarm water. And if you're experiencing any kind of itching over there, then we advise with turmeric water. Even there are in market available V-wash, which I generally don't suggest, which causes over dryness of that vaginal area. Generally, lukewarm water is suggested because that vaginal area is a very sensitive part. Application of any unknown fungal ointments or creams may affect in other way. Yes. Further, I'll be speaking related to the sanitary napkins, and now there are many questions. What should be used during menses? Some say cloth, some say sanitary napkins, some say menstrual panties, tampons, menstrual cups. Now these are majorly categorized into two: disposable and non-disposable. So now first, we'll go in disposable kind of sanitary napkins. These are again in markets also available in winged form and non-winged form. So we'll just have an overlook of which are the disposable kind of sanitary napkins. Panty liners or ultra thin. These are generally used when there is very little discharge during the menses. Regular during the second, third day, generally regular are used. Then maxi or super are used when the heavy menses are there. Night, it's generally longer in size or lengthier, which helps in application and avoid spillage during the night also. Then maternity type of disposable sanitary pads, in which they're used post-delivery, which is not applicable right now. Now, how should be the sanitary napkins? What features should be there? It should have soft surface, higher and faster absorption rate. Then dioxin free, good length, better adhesion, pleasant color with nice design, and easy disposable wrappers. Some of the local brands. Now we generally see I said in the last this that it should be dioxin free. So now these disposable sanitary napkins, they should be dioxin free because dioxin is a chemically related compound which is responsible for as an environmental pollutant, and International Research Center has labeled it as cancer 1 causing agent to the human. So that's why. And what are the effects of harmful this dioxin is? It causes endocrine disruption, cervical or pelvic or breast cancer, abnormal tissue growth in abdominal and reproductive organs, immune system suppression, endometriosis. So looking at these, back to the disposal, dioxin-free sanitary napkins are also available. So we saw to the disposable kind of sanitary napkins. Now we will see to the reusable or washable kind of sanitary napkins. These must be hygienically washed and dried in sunlight, which is said to be as a natural sterilizer. Cloth, again, is a reusable kind of, or we can say washable kind of sanitary napkin. In older days, our grandmothers or grandmothers were using the same. But in these reusable kind of or washable sanitary napkins, there is shame of drying these clothes outside or hide them or in damp, unhygienic places. These generally last for 75 washes. Then how it has to be washed and all those details are told over here, that it has to be washed, then dried in sun, and then reused when we are having our menses. It is recommended that these reusable kind of sanitary napkins should be boiled also in once in 3 months, and no brush applications also. And how to use is also mentioned. These kind of sanitary napkins are also available in market. Thus, we will move further to some other kinds of sanitary aids, we can say, sanitary tampons, and further we'll be looking for menstrual cups also. So these are prepared from absorbent material of rayon or cotton, and it comes with an applicator. It is fixed inside the vaginal this, and when it is filled up, then it is disposed. Then menstrual cups are also available. These are said to be most economical right now. It can be reused up to 10 years. How it should be applied is also given in details. Now, I'm trying to explain you what are the different kind of sanitary aids which are available right now. Disposable, non-disposable, reusable kind of. Now we'll come. Yes. Now, again, a big query in front of you. I have told you different kind of sanitary napkins, but now which is the best to use? I generally suggest my patients and to every girl child and a woman that maternity cotton pads is the just which I generally suggest, because it is safe, economical and healthy from female reproductive system point of view, which comes with a thread which can be tied around the waist and avoids spillage also, and useful during heavy menses also. Now we go to the disposal of these napkins. Now, in schools, when you are in schools, the disposal is in your washrooms. Newspapers are available, right? So when you go to the washroom, accordingly, you have to tear off the newspaper, wrap it in it, properly ensure that it is properly wrapped off, and then in the sanitary dustbin it has to be put in. Again, when you know that you are in the menarche phase, accordingly you have to carry a sanitary napkin along with you prior. So when these girl childs are in the menarche phase, yet to get their menses, every day they should carry a sanitary napkin in their bag to avoid embarrassment phase, fear, and shame of asking some other friend. In case you get it in school periods also, need not to take any kind of tension, because even sanitary napkins are available in school also. So accordingly, you have to approach your class teacher and then, or any teacher in the classroom, whoever is available, and she will inform the concerned person whom to approach. So there is no need to be ashamed of this activity, which may occur in school also. And when it is at home, you have to immediately inform your mother. And if she's well educated, or she has already told to you prior what is the menstrual phase, so you can have again an active discussion regarding what you will experience further in your further menses also. In many places, even sanitary disposal bins are also kept. Particularly at many institutional level, there are various projects carried out for proper disposal of these sanitary napkins, as if they contain dioxin, then it also acts as an environmental pollutant, and it may affect the green world which we are seeing now. Again, many incineration machines or incinerators kind of machines are also available, in which they are converted into powder form, burnt into powder form, and then even if they are dioxin free, they are used as fertilizers also. So now these are the premenstrual symptoms which we'll now further focus on. Prior to your menses, you may experience some symptoms. That is tenderness in breast. If you're wearing tight t-shirt or your dress or your slip inside, you may feel something is paining at your breast region just prior to menses. It may be 1 week prior or 2 to 3 days prior of your menses. Then you may feel depressed, not to do the regular things which you usually do. And as I said, you may feel angry, and you may feel angry in very small things also. And even mood swings. The things which you like, you may not like just prior to your menses. The food which you eat often, you may not feel to eat. So these kind of mood swings you may feel. Then you may feel muscle cramps. It may be on your tummy region or on your back, lower back region, or your thighs. Then you may experience even headache. So now this has to be differentiated. Presently, if exposure to online or media or mobile is more, the headache may be due to that reason also. So it should be differentiated whether it is due to the premenstrual phase or due to some other reasons. Then lack of concentration and loneliness. So as per Ayurveda, your premenstrual as well as menstrual phase should be completely fine. It should be normal as you are experiencing the premenstrual days also. So you should not experience any kind of pain. You should not experience any kind of mood swings, ideally if your hormones are in the balanced state. Now let's know what are the causes which may cause these premenstrual symptoms. So that is hereditary. My mother also experienced the same. My grandmother also experienced the premenstrual symptoms, and even during menses also she was experiencing pain. So I will experience pain. But again, I'll say hereditary can be changed with hormonal balance, with a balanced diet, which I'll be discussing further. Then vitamin B6 deficiency, calcium deficiency, magnesium deficiency, mental stress. It may be related to studies, it may be related to any household, maybe some time it may be related to household activities or overburden of studies or overthinking of any process. Then lack of exercise. I'll say lack of exercise is a major reason right now for experiencing premenstrual symptoms and pain. So in this slide below, I have explained the phases of our menses. I just wanted to indicate there are various hormones which are there in first 5 days, then 6 to 10 days, then 11 to 15 days. You have to just know that these hormones are secreted by our uterus. They are controlled by our brain, which has a pituitary gland. So these hormonal imbalance play a major role in our menstrual cycle, so which can be balanced through our diet. So first I'll come to the diet. So fruits in diet together, if we look, I have shared vitamin B6 food items, then calcium rich food, vitamin B6 rich food items, banana, chicken, oats, soya bean. Then calcium rich foods, milk, milk products, almonds, walnuts, spinach. Magnesium rich food, pumpkin seeds, almonds, dry roasted, spinach, cashews, dried figs, guava, papaya. So going in detail, we can define a daily schedule for our daughters, what they can have. So in the end, even I have mentioned yoga, meditation. So start of the day, if it is yoga, meditation, and I'm proud to say that City Pride School has also meditation sessions in the morning to start with, and even exercise, which plays a very major role in maintaining the menstrual health also. Then milk and milk products should be an integral part of their diet, which plays a very important role in keeping their bones healthy as well as the hormonal levels healthy and avoiding the premenstrual symptoms. Second is vegetables like spinach, then cabbage, cauliflower, cruciferous vegetables particularly, even onion, garlic or dark green leafy vegetables should be included, and even at breakfast also it is included. That is also a very good part. Then the fruits which I have mentioned, particularly vitamin B6 and magnesium rich. So particularly figs, guava, banana. So banana is a fruit which is available 12 months a year. So that can be an integral part again of the diet. Then fresh buttermilk when they are home from school, fresh buttermilk can also be an integral part of their daily routine. And cow ghee to be included, maybe application to their rotis on dal rice, and even we can say preparation of shira or halwa. So these we can make again an integral part. Then even fruits, like even these are the seasonal fruits which are available, that is grapes, blueberries, which are available seasonally, can be added in their diet. This is the most important part, that is don'ts. Now you see a big list over there. So this list is prepared keeping in consideration Ayurveda as well as modern aspects together, which this age group girls generally like. Pav bhaji, pani puri. This can be had, but in a controlled form, not on a regular diet. Means today the breakfast is of pav bhaji, tomorrow is of idli, day after tomorrow it is of Maggi. This shouldn't be ideally. Okay, because that causes, in a over period of time, it affects the hormonal levels and disturbance in the menstrual cycle. Again, the second problem which is faced is overeating or very less eating in this age group. Overeating may lead to obesity, again imbalance of hormones, and less eating can again cause deficiency of vitamin B6, calcium, magnesium, again creating the hormonal imbalance. Then the last which is mentioned, that is negative thoughts. Many girls have self-negative talk. Suppose in school, I'm not selected in particular event in school. So I'm not good at this. Then teacher doesn't like me. She takes only other students. She likes them. Jealousy creation. Okay, these kind of self-negative thoughts may also hamper your hormonal imbalance. And this generally happens in women also. Now, what can be done to have a healthy menstrual phase? So have adequate sleep. Now offline schools have been started. So now late night sleeping should be strictly avoided. Adequate 7 to 8 hours sleep. Then water intake. Now water reminders have been started in school since yesterday. So that is also a good part which has been started. So daily drinking water, minimum 2 liters of water throughout the day. Then citrus fruit juices. You can carry an extra bottle along with you of citrus fruit juices. Then regular exercise. So as even Dr. Ashwini mentioned in the orientation session today, that when you're home from school, you have to play at least 1 hour of physical exercise. Don't start to studies immediately or don't go to any kind of tuition class immediately. Then regular basis of cycling, I'll say. As per Ayurveda, there are different kind of opinions how to regularize your menstrual cycle or don't experience any kind of pain or during the menses or premenstrual symptoms. So cycling may be in the direct cycling form or as a home exercise, lying down on your back and revolving your legs in a cyclical manner. It helps to maintain your ovarian hormones in a balanced form. Then some yoga. These 5 asanas particularly have been told to balance your hormones, which would surely be helpful for all sitting in auditorium today and listening to the session. Baddha Konasana, Supta Baddha Konasana, Ushtrasan, Locust pose, and Prasarit Padottasana. So if you look at these asanas, it creates stretch on the lower abdomen or lower tummy portion, again regularizing. This slide is an indication of 2. Now, whatever we have seen today at this session, so try to self-introspect that how we had our first experience during our menses and what kind of our daughters expect. So we should educate them. Then on regular basis, we along our daughters also should meditate. Then self-introspect whether we are positively accepting their puberty changes or we are getting angry, we are getting panic. So self-introspect, that remain cool, calm, and analyze whether these puberty changes my daughter is experiencing, are they normal? Normal, then need not to worry. Go ahead, keep the diet and those told things at this session continued. And if you're finding any kind of abnormal, this maybe early changes or by the age of 14 to 15 also, if the menses haven't arrived, then you should surely approach the gynecologist and address your concern. The more we talk about periods, the less shameful we feel. And the less shameful we feel, the more powerful we are. Now, this indicates that talk openly to your mother, your grandmother regarding these things. And if your doubts are not solved, don't discuss with your friends. Discuss with your mother first. If not solved, then your grandmother. Not solved, then to a doctor. Because in these situations, your friend may not be a good guide to you. Because she may misguide you. She may frighten you more. So that shouldn't happen. I thank CPS family for inviting me over here and giving me opportunity to share my views on this a very sensitive topic today. Thank you so much.
Thank you so much, ma'am. I think a big round of applause for such a sensitive topic. I think you can quickly take few questions. Yes? Anyone with any question? Mothers, daughters? Wow. If you can be louder, how do I pass the mic on to you? Yeah. So there's a mother here, there's a daughter here. Where do I move? Okay, I'll come the other, this way. Yes. Yeah. I'll just come to you, Jay.
Hello, ma'am. I have a question that can they exercise while having their periods?
No. During menses, no exercise at all.
Okay. Yeah, that's it. Thank you.
But just to add on, I'll say there are PT periods in school.
Hello, ma'am. I wanted to ask that many people say that we shouldn't take any painkillers while we are on our periods. So I just wanted to know the reason why.
See, during your menses phase, your acidity is on the peak level or the hormonal surge is of estrogen during your menses. So already you are experiencing anger, discomfort, And when painkillers are taken, the side effects of painkillers are to aggravation of that pitta again, or aggravation of your acidity. Though that may subside pain, but it will not subside the mood swings, the anger surge which you are experiencing during your menses or your premenses.
Hello, ma'am. Miss, I have a doubt. Like, Miss, you told us that all the pads should be colorful, and I didn't understand why.
See, during our menses phase, if we have a pleasant thought or a pleasant mind, so when we look to the green environment outside, or when you have a colored day in school, the environment is pleasant. So our anger or the mood swings which we experience in the initial days of our menses cools down, calms down. That's why I'm saying colorful pads also.
Yes, sir. I have heard a lot that milk consumption, particularly A1 milk consumption, can lead to early harmful effects. And but you have suggested about milk problem. So can you throw some light?
I couldn't hear you properly. Can you repeat the question?
Can you hear me now?
Yes, yes.
Yeah, I heard and read a lot about milk consumption, particularly A1 type milk consumption, that is of Jersey cow milk. So can it lead early hormonal growth in girls? Is it one of the cause because of early menarche?
Yes.
So should we avoid total milk consumption? Or can you throw some light on this topic?
See, if cow milk is available from a proper dairy source, that is recommended. So, Jersey milk will cause even carcinogenic, even there is research going on Jersey milk, which may affect the even breast development and cause cervical cancer, breast cancer also. So now organic or A2 milk we can say is recommended. The first preference which I give is proper source cow milk from a dairy or door-to-door vendors.
Any other questions? Yes.
Hello, ma'am.
Hello, ma'am.
Yes.
Despite we are on our periods, what if there are so many PT periods, dance periods, what about that? And all teachers are sirs. That's nice.
Yes. I would add on related to exercise. I was added in on that you having your exercise periods in the school also. So when there is heavy menses, if it is first or second day and you are experiencing heavy menses, then you can inform your class teachers in advance that today is the period I'm experiencing the menstrual cycle. It is my first day or second day or so on, and I would not be able to attend. So maybe there, I think, so simple kind of physical exercises also which are done, which doesn't involve too much exercise or bending down of exercises. So accordingly, you can do that in that period. Or if it is too heavy or you're experiencing any kind of pain, then you can just take a rest. Don't go to any kind of physical activity periods.
Yes. Any other queries? Any other questions? Mothers?
Hello,
daughters?
ma'am. Hello, ma'am. Can you hear me? Ma'am, I'm online.
Online. Yes.
Good afternoon, ma'am.
Yes, good afternoon.
Ma'am, I have few questions. In that, the first one is, why do irregular cycle appears?
Irregular cycles may be due to your irregular daily schedule, late night sleeping, late night waking up, then following irregular meal patterns, or if again some kind of deficiencies, that is magnesium or calcium deficiencies, or if you're not having your healthy diet.
Okay, ma'am. And the second thing is, it's mentioned in don'ts, sprouts shouldn't be eaten.
Yes, as I mentioned, I have made a combination of Ayurveda and modern perspective together. As per Ayurveda,
Okay.
sprouts on regular basis, that is on daily basis, aggravates pitta, and it may cause or acidity in simple form, we can say, and it may cause heavy menses or menstrual pain also.
Okay. So during periods, we should not eat, or otherwise we can eat.
Yes, yes.
Or we shouldn't eat.
Once in 15 days, I'll recommend.
Okay, ma'am. And one more thing is, you said we wash is not recommended, but in case if there is a more kind of itchiness, so is there any good wash that you can suggest for us?
Okay, I just request, sorry to disturb you, ma'am. I just request 6 and 7, only the bus children who will be going by bus to form a line and come out, because the buses are waiting. Those who are going with the mothers, please wait. Rest all who are going by bus 6 standard first, please move out in a line. Yes.
Yes, can you please repeat the question?
Yes, ma'am. You said ki V-wash is not recommended by you, but
Yes.
if the itching is more and if we need a wash by soap or some kind, so is there any good brand that you can recommend for us?
See, as per Ayurveda, I generally recommend turmeric water. So we can take turmeric powder. If it is 1 liter of water, for example, we can take half spoon or 5 grams of turmeric powder.
The mothers, please wait before picking your child. Let's clear the crowd by sending the bus children first. Rest, please be seated.
So half spoon of turmeric mixed in 1 liter of water.
Okay.
And then that lukewarm water, and then that can be used for washing of the vaginal parts.
Okay,
Rest,
ma'am.
please
Thank you
settle
so much.
down. I hope the bus children have moved out. Rest, please settle down.
And why fermented food is not recommended, ma'am? Is there any scientific reason?
Yes. Again, from Ayurveda perspective, having fermented food also on regular basis causes aggravation of pitta and vata dosh, and causes more kind of premenstrual symptoms and menstrual pain also. That's why we don't recommend also on a regular basis breakfast also for fermented food.
So how can we eat it, like as you said, for sprouts once in 15 days or weekly once?
Once in 15 days.
Okay, ma'am.
Okay, the local children whose mothers are not here, I request you to move out. The local students who need to go by their mode of transport, please move out in a line. Quietly move out in the line, please. Go from behind.
Yes, any more queries?
Quickly, children, please. We need to disperse the others as well.
Are you able to hear me?
Hello?
Yes, till then I think on behalf of, sorry for this now because the transport is waiting there, so I had to move out few of them. Yeah, thank you so much, ma'am. I think a very sensitive topic handled quite patiently, and I think it's quite clear in our minds now. Because we all do have questions in mind, how to talk to the child, how to make her comfortable. The child may have a question as to how do I take out this topic. They're not aware of what is going on. So let us be with them together. And I'm sure, I think the joy when I saw on their faces when they saw their mothers entering after some time, definitely it's a plus point to, strengthen the bond which you all have together. So please do that and discuss these topics in detail with them. The more they talk to you, the better. As ma'am said that in these cases, let's not discuss this in detail with our friends at the first go. Yes, you can share your mail with them, but the information part, let us take it from the others. Yes, that's what we'll go ahead. So on our behalf, I think we would like to thank Preeti ma'am. Thank you so much for your time. May I request Leena miss to please hand over the token.
Excuse me, ma'am.
Yeah, just 2 minutes. I'll answer the question just in after 2 minutes.
Okay, ma'am.
Yes.
Yeah, a big round of applause to Preeti ma'am. Thank you so much. Yes, and with all the instructions given, one kind request, I think when we are guiding our daughters, yes, what we have observed is ties in the school find it very difficult if the hygiene is not maintained by the girls. Yes, that is disposable of pads. So it becomes very difficult, and because it's a co-ed school, it's not very easy for us to go to every class giving them these instructions. Maybe we may find it, but they may not find it comfortable to take in the classroom. We don't want to do that, going to classes and guiding them on these lines. So when we are talking to our daughters, please guide them as to how do they dispose the pads when they are in the school. Because it is very, very difficult for the ties to keep cleaning these things. And I think that's not fair enough as well, because they are really not disposed in the right manner. Definitely they may not know the right way, so let us guide them. And second thing is, if they are going for field visit or picnics, guide them completely as to how they need to dispose there as well, because it's a different environment altogether. Yes, and also what kind of clothes they wear at that time, because they are going to be out somewhere, they have to be comfortable. Field visit, definitely they go in a uniform, there is no doubt. But henceforth, if things settle and they have their picnic, whatever comes ahead, let us guide them all through wherever they go, so it is comfortable for our child itself. Yes, so please keep in mind that whenever you're instructing them, please keep these things in mind. Yeah, thank you so much for your time on a weekday. Thank you. I think you deserve a clap to be here. Thank you, the mothers and daughters. Thank you so much, ma'am. I hope we have submitted the feedback forms. If not, kindly do so, and also we have kept the contact card of Preeti ma'am here. In case anyone wishes to, you can collect it from us. Thank you.
Hello, ma'am.
Yes, hello. Yes.
Can I ask, ma'am?
Yes, you can ask.
I don't know whether it is a myth or not. I have heard that after getting a period, we shouldn't take our head bath on third day or fourth day. So is it true or not? I don't know. I have just read somewhere it directly affects the what to say ovary system. I don't know. I'm sure it's true or not.
Yes, it is true. Till you complete your menses.
Okay.
The menstrual flow is sometimes spotting continues for fourth, fifth day also.
Okay.
Till the menses are completely stopped, you should not take head bath. As
from the first day, okay.
As it may cause uterine contractions, you may experience pain. or
Mm.
the flow which should be continued may get stopped.
Okay.
Yes.
So right from the first day till the flow comes down, we shouldn't take a head bath.
Yes, that's right.
Okay. Thank you. Thank you so much, ma'am.
Okay. Yes. Any more questions?